The Centers for Disease Control and Prevention reviewing pregnancy-related deaths in the U.S. over a 4-year period, finding minority women have a higher risk of death than Caucasian women.
According to the report, the pregnancy-related deaths occurred during pregnancy, around the time of delivery, and up to 1 year postpartum. 23 ABC's Leslie Gooden joins us in studio with more on that report. Leslie?
That's right. The CDC says that around 700 women die annually in the U.S. from pregnancy-related complications, and the report offers methods of prevention.
Education, education. That's what I push when I see my patients every day.
Dr. Edward Allen, OBGYN physician for Dignity Health Medical Foundation in Bakersfield, agrees with the Centers for Disease Control's report, which states that African American, Native, and Alaskan women have a 3 times higher rate of pregnancy-related deaths than Caucasian women through his 35 years of practice.
Afro-American females have a higher incidence of chronic diseases that lead to these problems, such as diabetes, hypertension, obesity, and then if you look at lack of access to care.
CDC report states that 60% of all pregnancy-related deaths can be prevented with better health care, communication, and support.
Our responsibility to be sensitive to patients, to be able to educate them, to listen to them. That's one of the issues that we have too often is that, and I hear complaints from patients, that this doctor didn't listen to me. Because most of the times, if you actually take the time to listen to the patient will tell you what the problem is.
Another report by the American College of Obstetricians and Gynecologists states that significant racial and ethnic disparities persist in women's health and healthcare, and eliminating those inequalities should be a top priority.
I think going forward, the key here is education and listen to women. We know what's going on with our bodies. We know when there's something wrong. And the CDC says that more than half of these deaths are preventable. So for years, women have been blamed by hospitals and service providers for being too fat, too old, and too unhealthy, but that's obviously not the case.
Dr. Allen says another contributing factor towards this gap is finances and possible lack of proper health care.
Other problems that we have, many of the patients don't have insurance, or if they do have insurance, they get it late in pregnancy. So they start out behind the 8 ball because they've not taken care of the pregnancy early on.
If you would like to read that full report and learn more information, head to our website, turn23.com. Live in studio, Leslie Gooden, 23 ABC, connecting you.